and I'm a student here at the LECOM School of Pharmacy. Today I want to show you guys how to do blood glucose, blood pressure, and blood cholesterol testing. And I'll do that by performing a short skit. Enjoy!
Robbie, this upcoming health fair, I'm just kind of nervous about it, about the testing. Yeah, I wish there was some type of video to show me how to do it.
Sherry, we can do the video. Tyler can record it. And hey, Andre, he'll be the patient. He'll say yes to me. He always says yes. Can you be the patient for our video?
No.
Andre, but it's for the incoming pharmacy class, and Sherry really wants to do it.
Oh, why didn't you say so?
Well, okay. Well, come
Let's
on.
do it.
All right, go ahead. Go. First, I'm going to show you how to perform the cholesterol testing. But before we get started, we have to get the patient's consent. Andre, before we get started, I just need you to check the test that you want me to do today. Go ahead and sign the bottom and date.
Okay.
While he fills this out, I'm going to tell you the materials you'll need for the cholesterol screening. Here's your hand sanitizer. You'll definitely need this between each patient. Make sure you sanitize your hands good. You'll need gloves. Make sure you get the correct fitting pair. Put those here. You have your cholesterol machine, your lancet. This is an individual lancet. Some people use lancing devices. This is a one use. This is a capillary you will need to draw in the blood from the patient up into the black line. You have your alcohol swab, your cotton ball or cotton round. I like the rounds better because they don't peel so much. Your panel strip and your Band-Aid. Okay, so first you want to get your gloves on before you start. And I always like to ask the patient which finger they would like pricked. Andre, which finger would you like pricked today?
Index finger is fine.
Okay, it's going to be a little sting when I do prick your finger. Okay, are you taking any medications, anticoagulants like warfarin, aspirin, or Plavix that can make you bleed more?
No.
Good. Okay, it's good to ask these questions to the patient because if they are taking these medications, they will bleed a little more and you won't massage the finger as much. I massage the finger before I use the alcohol wipe. Here's the alcohol wipe. And you want to make sure you do one clean swipe, not to recontaminate. And while the patient's finger is drying, you can go ahead and set up the machine. Get our cholesterol machine here, and our panel strip. Go ahead and put it in here. And when you're performing a test, it's very important not to touch the patient's finger where you clean. Next, you want to take your lancet, go ahead and uncap it. Take the patient's finger, but be careful not to touch anywhere that you already cleaned before you prick the finger. Just put it here. Are you ready?
Yes.
Just a quick prick. And the patient will begin bleeding. He's not bleeding as much, so I'm going to go ahead and squeeze his finger a little. Get some blood. For this one, you need a little more blood than if you were going to do the glucose test. Are you okay? Okay. You're going to take your capillary here, turn it, tilt it to the side to get the blood inside this capillary here. If this happens, you have to milk a little more. To get more blood. This is a little harder of a test because you need so much blood from the patient. We're almost there. Just a little bit more. Now we're up to that black line. So what we'll do, just hold your finger for 1 second. I'm going to wipe it with the pad here. We're going to put the blood on our panel. You just press down here to make it all come out. If the patient is bleeding a lot, you can ask them to hold the cotton round or cotton ball on their finger while you do the test for them. And go ahead and open the Band-Aid. There's a little blood there. Take this off. Right here. All done. It's important that you take the lancet and make sure it goes into a sharps container. Sherry, can you please send me the sharps container?
Of course.
The rest of the items, because you kept them all in a paper towel, can just be rolled up. Gloves. And all thrown away. Make sure you sanitize your hands between patients. You want to write down the results that you have on the screen. You write it down in the patient consent form that you have them fill out, and also on a card for them to take home. Now let's look at what these results mean. Don't worry, you'll have the fact sheet with you to guide you when you're working with the patient. Now that does it for our blood cholesterol testing. If any of the results are abnormal, make sure the patient sees a pharmacist on site. Now I'll show you how to do your blood glucose testing. Here you will see the materials you will need for your blood glucose screening. You'll need your hand sanitizer. You want to make sure you sanitize your hand between each patient. Here are the gloves you'll need. Make sure you have the right size. This is the glucometer, or the glucose machine. These are the strips, the test strips. This is your single-use lancet, the alcohol swab or alcohol wipe, your cotton round. You can also use a cotton ball. And here's your Band-Aid. And these are the materials you'll need. For blood glucose screening, it's important to know what the patient has eaten. Andre, have you eaten anything today?
Yeah, I ate breakfast this morning.
Yeah, what did you have?
I had some oatmeal, tuna, cottage cheese, apple, and banana.
All this morning.
Yeah.
Okay. Have you ever had your blood glucose done before?
I had one done in LECOM a few months ago.
A few months ago? Do you remember the results from the reading?
No?
No? Or did your doctor indicate that you have high blood pressure or diabetes?
Robbie, I'm Mr. Healthy.
Okay. With the information given, you'll know where to look for the results. So you want to hand sanitize your hands. Get the right fitting gloves. Then we're going to alcohol swab the patient's finger. Which finger would you like?
Index finger is fine.
And after I wipe his finger, you can set up our machine. One clean swipe, not to recontaminate. Here are the strips. You just need one strip. The arrow indicates how it goes into the machine. So I'll take the glucometer and put it in. And it automatically turns on. It will time out, so that's why I cleaned his fingers first with the alcohol swab. You have a few minutes to do this. His finger is clean. Next, you'll take the lancet and you'll prick the finger. You'll take your machine here. If you need more blood, you can go ahead and gently massage. You only need a little blood for this test. Takes just a few seconds to get the results. And if he's bleeding, you want to make sure you take the cotton ball or cotton round and wipe his finger. If he was bleeding a lot, you would ask the patient to hold this while you get the results. You want to take the Band-Aid, open it up. Alrighty, let's see if you're bleeding. If he's not bleeding a lot, he doesn't have to have a Band-Aid if he doesn't want to, but I'll just put it on for you. And you're all set. Here are the results. So what you have left to do is discard the materials that you've used. You want to make sure the lancet goes into the sharps container.
So only the lancet goes in the sharps container?
Yes. Can you please hand me that container?
Of course.
Go ahead and take out your strip. Everything else can get rolled up in the paper towel and then thrown away in the regular trash. And after the blood glucose screening, you want to make sure you sanitize your hands and write down your results on both the patient consent form and a form for them or a card for them that they can take home. And if the results are abnormal or fall out of range, make sure they speak with the pharmacist on site. Now that we've done the blood glucose screening, we'll move on to blood pressure. The automatic blood pressure machine is what you see here. All you have to do is press this button for it to work. There are a few important questions that you need to ask a patient before blood pressure testing. You want to see if they had any caffeine today, if they have done any exercise, and if they smoke cigarettes. All these things can alter the results of the test. Have you had your blood pressure done before?
No.
No? Okay. So this is going to be your first time. There's a few things, and if the patient had a jacket on, you would have them remove the jacket so you can get accurate results. So is it okay if I roll your sleeve up?
Yep.
Just roll it up just a little bit. You want to make sure the patient is relaxed. Are you relaxed today? Are you fine? Did you just have any exercise?
I'm okay.
Okay, and have you had any caffeine?
No.
Alright, asking just a few questions there. It's important for you to have your feet flat on the floor to get the accurate results.
Okay.
Perfect. What you want to do is have the cord facing you, and this artery mark will go on the brachial artery here. Put your arm in. You just put it here, make sure you feel the pulse, and tighten it up. The cord should follow to the pinky of the patient, just to make sure you're doing it right. Okay, because this is your first time having your blood pressure done, when I press start, it's going to get tight. If it gets too tight, just let me know.
Okay.
Okay? Try to refrain from talking so we can get the best results, okay? And you want to make sure you write down these results. If they are not normal, you want to make sure the patient speaks with the pharmacist on site. Sherry, do you feel confident about performing the testings now?
Absolutely.
Awesome.
Thanks everyone for watching. Now go out and
Get
involved.
Feels good, don't it?